welcome. My name is Joseph Greenwell. My pronouns are he, him, and his, and I serve as the Vice President for Student Affairs and University Life here at Columbia. I'm so excited to be here with you today as we talk about reopening campus and welcoming you home. University Life is a student hub for information, resources, events, and initiatives that support inclusion and belonging, health and well-being, sexual respect, and community citizenship. We have a great conversation planned for you today. After 18 plus months of managing the COVID-19 pandemic, each of us has been impacted, some far more than others. I want to also recognize that COVID-19 is very much still with us and affecting us globally. But we are in many ways at a positive turning point in this pandemic. Since we hosted our last forum in May, the landscape for our fall reopening continues to evolve and to be very hopeful for a wonderful reopening of the university this fall. We are excited to welcome you home to Columbia. By showing up today, you're helping to do your part to keep yourself and your community safe. So please accept my gratitude to each of you for being here. Today, you'll hear about our plans to reopen safely through vaccines and other key measures to combat the pandemic. You'll also hear about our plans for the academic return. We have two major goals today for this conversation. The first is to share critical need-to-know information, and the second is to provide space for your questions. We'll meet each of these goals by sharing actionable, updated, evidence-based information with the larger aim of keeping each of you, and by extension, our larger community, healthy and safe. Turning to our program today, our thanks again to all of you for joining us and to many of you who submitted questions in advance. They've been shared and are part of the presentation, and whatever we don't get to, we'll do in our Q&A. Now, if you have questions during the presentation, please use the Q&A chat. I see some of you already doing so. Feature at the bottom of your screens in the Zoom, and we will answer them both verbally as well as in the chat themselves. Now, if you're watching by live stream, you can also submit questions to us in University Life at universitylife@columbia.edu. We are also partnering, and I want you to know, with Disability Services for this event and have a captioner present if you need closed captioning. I will moderate the conversation during the first segment of the conversation, and then that will be followed by a Q&A. As we do always at University Life, this video will be shared in a few days on the University Life's website, so you can go back to it and you can also share it with your friends who maybe couldn't join us today. We are so fortunate, I have to tell you, to have this incredible panel with us today. I'll be very brief in my introduction so that we can really get to the heart of the conversation, but I really truly encourage you to Google each of the panelists and learn about their incredible contributions, not only to Columbia, but well beyond. I'm pleased to welcome Donna Lynne, who is the Senior Vice President and Chief Operating Officer of Columbia University Irvine Medical Center and the CEO of Columbia Doctors, which is an 1,800 member faculty practice. She also serves as the university's COVID director. Melanie Bernitz is Senior Vice President for Columbia Health, who joined Columbia Health in 2016 and served as the Associate Vice President and the Medical Director through the early 2021. She is also Associate Clinical Professor of Medicine in the Center for Family and Community Medicine. Julie Kornfeld is Vice Provost for Academic Programs and Associate Professor of Epidemiology at the Mailman School of Public Health. As Vice Provost, Dr. Kornfeld oversees the university's broad range of academic programs with a focus on compliance, policy, and regulatory requirements. Last but far but least, Wafaa El-Sadr will be joining us for the Q&A. And Dr. El-Sadr is a university professor of epidemiology and medicine, the director of ICAP, and the director of Global Health Initiative at the Mailman School of Public Health, as well as the director of Columbia World Projects. Since the start of the pandemic, Dr. El-Sadr has played a pivotal role in assessing the COVID-19 pandemic with a global health perspective to inform university policies. So without further ado, I'd like to open up the conversation by calling on Dr. Lynne to share key updates on the vaccine availability in New York for Columbia faculty, staff, and students, to also speak about the latest information students need to know about university policy and reopening.
All right, well, welcome everybody, and it's great to be here and exciting to think about a full return to campus. That I know many have been on campus, many have been remote, and we're excited that we really can announce right now the full return to campus in September. As Joseph said, what I want to just do is give you a little bit of a snapshot around what COVID looks like here in the United States and in New York City in particular, if you're coming from another part of the country or even farther. And Melanie is going to complement that by really getting down into what are the steps that you need to take as you prepare to come back to campus. And hopefully some of this information is not new, but we've found that the Q&A time just allows us to get to some more specifics. So first of all, you know, a little bit of alarm, I would say. I want to take you to, if you haven't been reading about this, the average number of cases in the United States over the last 14 days has actually increased by 100%. Now, a lot of that is occurring in areas where there are much lower rates of vaccination, but even in New York, although if you did the division, New York's cases are actually very low relative to our population, as well as our hospitalizations. But we're also seeing an increase in the number of cases, excuse me, in New York, as well as in New York City, excuse me. So what's been our strategy both at Columbia, but certainly across the country? And that is to, as we say, get as many shots into arms as we possibly can. And the president, who set up a goal for 70% of all US citizens being vaccinated by July 1st, we didn't quite make that across the country. We did make it in New York State. And as a result of getting to that 70% number, the governor released and changed a number of the restrictions that we've had at Columbia. And we're going to share with you, you know, what's the current state of requirements around face coverings, around distancing, and so forth. But there is a fundamental belief, both nationally and at Columbia, that the solution up until now has been, you know, other interventions, what are called non-pharmaceutical interventions. But once the vaccine became available, the efficacy and the safeness of the vaccine has been certainly proven over the last 7 months or so, not to mention when it was in trial. And so the vaccine mandate that I'll talk about in a minute, you know, definitely reflects the evidence that we've seen so far. New York City, which if you think back over the last 16 months or so, you may recall that we were in fact the epicenter during March and April of 2020. We also had an alarming increase in the number of cases once the cold weather rolled around at the end of 2020 and into 21. And I'll show you some data around how that has changed. But again, we're still watching, you know, even slight movements we are concerned about because we have seen them before. The vaccine data in New York City is a little less successful than it is in the state. So if you remember, the state number was 73% of all people having received, at least adults receiving 1 dose. The city data is below 70, but not very much. It varies greatly by where you live. Excuse me. So there are pockets of the city, particularly in some areas in Brooklyn, in Queens, Staten Island, and a little bit in the Bronx. But in Manhattan and all the areas adjacent to our campuses, we've seen a great uptake in terms of the vaccine. So the mandate, we did announce the mandate for students, as you may recall, in April. We extended it to faculty, staff, and and researchers in May, and we're in the midst of doing that compliance. Our rationale, which is, as I shared with you, is we want to protect the health of our affiliates, but also our surrounding community. And you saw great compliance with vaccine across the Manhattan and in particular around the Morningside and even the upper Manhattan areas. We're not alone. Over 570 universities and colleges have announced a student vaccine mandate, and a little under half have announced it for faculty and staff. One of the things Melanie will share with you, as I said, are sort of the step-by-step activities that you're going to need to take when you come back to campus. One of them is having something called Reopen CU. That is our own branded app that is available in the Android and the Apple stores. And it's a handy tool for admission to buildings, for showing that you've complied with all of the mandates. But one of the things that we wanted to commit to you is we're not just asking you to do things like get vaccinated, wear a face covering when it's necessary. We're also committing as an institution to do things for you. So whether it is cleaning, it's changing some of our air handling, which we've done, and really enforcing some of the safety measures, because I know we want to make sure that everybody feels that the university is participating in keeping the campus safe. So what is acceptable in terms of the vaccine? We have 3 vaccines that are US FDA approved: Pfizer, Moderna, excuse me, and I drawing a blank, Johnson & Johnson. They are, the first 2 are 2-dose vaccines. The Johnson & Johnson is a 1-dose vaccine. We're also allowing, as a testament to the vaccine mandate, World Health Organization approved vaccines. There are 3 of those. They change from time to time. In other words, additional ones are authorized, and we have given you a link on the website so that you can check, what vaccine might be approved. If you have gotten an unapproved vaccine, we will revaccinate you here on campus. And we've been administering vaccines for months now for our faculty, staff, and students, as well as doing some testing that Melanie will describe. Excuse me. Okay, so this is what the app looks like. If the app itself is a Columbia crown. But once you get into the app, you have several things that you need to do. Acknowledge whether or not you have any symptoms. You do that daily. And then there's a checklist, as you can see at the bottom of the left-hand side, that when you have completed all of these things, you will have check marks here, and it will provide for you something that we call a red pass or a green pass. I've got a green pass, which means I can come into the campus today. I'm showing it to you on my screen. The right-hand side is the vaccine attestation, and you simply need to go to on the My Checklist list, you need to go to that line, and you need to submit this information. This is for faculty and staff. There's a different process for students through Columbia Health that Melanie will describe. And then I just want to mention to you in particular the last bullet on this slide, which is, one of the things we've learned over the last 16 months is that things change constantly. They probably change weekly, and sometimes they change daily. For the most part, the things that have been changing recently have been a lifting of restrictions. So in the first 3 cases, the ability to come back to classrooms and not have to distance and to be in person, the ability for changes in face covering or masking requirements, and there are a lot of other restrictions that existed around capacity size and buildings and the like. The governor has lifted all of those. So those have all been a positive step forward. The one thing that he did that actually was a step in a different direction was that beginning June 25th, he announced that individuals coming from international destinations, so if you're a student who's coming from an international location, or even you were just traveling, you might be a domestic student, there are now quarantine and testing restrictions. So that's my little overview. As I said, I'm going to turn it over to Melanie because she's going to get into the how we do things, and then we're happy to take some questions that you can ask about any aspect of either the vaccine or what a return to campus looks like.
Great, thank you so much, Donna, and good afternoon, everyone. I'm going to share my screen. And hopefully I have been looking and answering some of the questions, so hopefully I'll be able to address some of those through my presentation as well. Glad so many of you are able to join us here today. So Donna shared some of the New York City data, and I just like to always share our updated campus picture. Actually, throughout this pandemic, our campus picture has consistently been even better than the New York City situation that you just heard described. And since June of last year, so in just over a year, we've done almost 300,000 tests on campus. Our cumulative positivity rate is only 0.33%. We also do random surveillance testing, which really gives us a true prevalence estimate of what's going on, and that's very low, ranging at 0 as it was last week, up to only 0.37%. And so I share these with you because these really are a very strong indicator of the safety of our campuses. We continue, even with low case rates, to continue to track all positive cases, those that we test through our testing systems that I'll explain, as well as those tested outside out of the university. And we have a contact tracing team that we house on campus. They respond very rapidly. More so than any other contact tracing team that we've heard about. And we know that this rapid response really prevents any further transmission. I also always like to highlight, for those of you who haven't checked out, the website that the university created last year dedicated to all things COVID, covid19.columbia.edu. Bookmark that site. Anytime you have a question, go there first. There are so many FAQs there. There's actually a chat bot where you can ask questions, and there's real-time data being updated. So it's really the good first stop if you have questions, because you may well be able to find the answer there. Before I get into the details, I also want to share how we adopt guidance. And this is kind of the process we've used actually for the last 18 months. And it's a very iterative review process, looking at the global level and then nationally at what's coming out of the Centers for Disease Control and Prevention. Then recommendations come to New York State level, usually to the New York State Department of Health, and then even more locally to the City Department of Health. And then the university is able to make decisions and determine the campus-wide impacts. So we really look at all the guidance, recommendations, requirements, and data that's coming out of all these sources, and we use those to inform our campus response. And nothing is really happening in a vacuum. And I think we can pretty honestly say that this has been a very successful approach, one that we will continue to use as we go through the summer and into the fall. And when we look back at how this approach has worked, we've been able to avoid shelter-in-place orders, we've kept our labs open, we've really ensured a very safe campus environment for you to return to. So now into the nitty-gritty of the things that you have to do. So the daily attestation. Our community who's been here throughout has become very familiar with the daily routines about coming to campus, and we know that these daily routines actually keep us safe. It's been about wearing masks, keeping distancing, staying home when you're sick. And this daily attestation that Donna described, the Reopen CU app, has to become very routine. I say to everyone, if you're not familiar with it, it will become as routine to you as hopefully brushing your teeth in the morning. And we've adjusted this, and we will continue to adjust how the app works based on our experience. And so the current system is very intuitive, and it allows you really to honestly and quickly answer the daily app questions, which will tell you if it's okay for you to come to campus because you're getting a green pass, or if you should stay home. So there's 3 daily questions that everyone answers, and you answer those questions regardless of whether or not you're vaccinated. This really is to give you that daily access to campus. The green pass only lasts for 24 hours based on your responses to those 3 questions. And they're about if you've tested positive, if you've been in close contact with someone, or if you're having any symptoms. You click the relevant box, and then you hit submit and hopefully get your green pass. But there's also a checklist underneath that, and we're going to go through some of these requirements now. But if you don't meet these requirements by the deadline, and you don't have the checkbox by the deadline, you will get a red pass, and you won't be able to swipe access into campus. For those checkbox items, you can't just check the box. You actually have to do the activity associated with that, and then the box will get automatically checked. So I'll explain some of those as I go through my presentation. But I wanted to share this slide about travel and quarantine and testing first, because I know this, we're so excited to welcome you back to campus. We know that many of you are not in New York, so you might be traveling to get here. And the requirements regarding travel testing and quarantine are different depending on where you're coming from, firstly, if it's domestic travel or international travel, and whether or not you're fully vaccinated at the time when you travel. And remember, fully vaccinated means vaccinated with an FDA-approved vaccine, one of the 3 in the US, or one that's approved by the World Health Organization, and having had your final dose at least 2 weeks before you travel. So for domestic travel, there's actually no requirement at all for fully vaccinated individuals. You can travel freely, you don't have to test, you don't have to quarantine or anything else. If you are not fully vaccinated and undergoing domestic travel, the recommendations, these are recommendations but not requirements, are that you test before your trip, 1 to 3 days, and 3 to 5 days after you travel. And you may want to consider quarantine for 7 days when you arrive. You should certainly avoid contact with those who are at higher risk, but these are recommendations. International travel is different. These are requirements for international travel. So those who are fully vaccinated, again, using the criteria I described before, in fact, everyone, regardless of vaccination status, is required to get a test within 3 days of travel to get on a plane to come into the United States. So that is a requirement for everyone. Get that test, PCR or antigen test, within the 3 days prior to travel, or you won't be able to board your flight. If you are fully vaccinated, you are also required to have another test 3 to 5 days after you arrive in the United States, but you don't need to quarantine while waiting to do that test on day 3 to 5. And that test is a test you can do with us as your gateway test, which I'll talk about in a minute. Those who are not fully vaccinated and arriving from an international destination, it is a much stricter requirement. Again, the test within 3 days before your trip, and then a test at day 3 to 5, but you are required to quarantine for 7 days after your arrival. You can keep that quarantine at 7 days by doing the test on day 3 to 5, and we'll support you on that. If you don't test, it would be a 10-day quarantine, but we expect everyone to get that test and only have to do the 7-day quarantine. So that's the requirements. They are up on our website. And again, just please note the difference for international travel and the differentiation between fully vaccinated and not vaccinated. So testing, we always get a lot of questions about this. Just to say, we've been doing testing since last June, and the approach to testing has been evaluated numerous times. We've adjusted it, and we really take input from a wide range of experts: epidemiologists, modelers, statisticians, infectious disease specialists, public health professionals. And we've been really nimble and adaptable with this testing program based on what we're seeing on campus and around New York City. And we will continue to be flexible and adaptable as we move into the fall. So again, the plans you'll see from me right now are the plans right now. But again, if things change, we can adjust those plans very, very rapidly. And to do this, we've created 2 large-scale, high-throughput testing centers, one on our main campus at Morningside in Lerner Hall, and the other at the Medical Center campus in the Black Building. And between those sites, we can routinely do over 3,000 tests a day. We'll probably reduce this volume given the impact of vaccination. But again, we have the capacity to do thousands of tests a day. So as you think about coming back, don't worry, we have adequate capacity to support the testing. So for the fall, we require something called a gateway test. A gateway test is a re-entry test. It's basically the first test you get when you come back to Columbia. This is only required if you haven't had a test with us in 2021. So if you've not been here, the first test you get is this gateway test, and is a requirement, again, regardless of your vaccination status. For those of you who are vaccinated, you could do that before you come back to campus or as soon as you return. But everyone is required to complete this by September 9th if you're returning before September 9th. If you are unvaccinated or partially vaccinated, you do have to have that test and have the results of that test before you can access campus. If you're moving into campus housing and you're an international arrival and you're quarantining, you can do this test during your quarantine day 3 to 5. So it counts as your gateway test and your travel test all at once. It's one and the same. If you are not arriving internationally, but you are not fully vaccinated, you will have to do that test as soon as you arrive and quarantine until the results are available before you are able to access campus. So again, for unvaccinated, you do need the result of that gateway test before you can access campus. So the gateway test is the first test. Then we have ongoing surveillance testing. And as I mentioned at the start, this program has really allowed us to monitor the campus prevalence of COVID-19 and think about if we need to adjust any of our other broader public health protocols. So again, different depending on your vaccination status. For vaccinated individuals, you will participate in our random sample. What this means is we take a random sample of those who access campus on a given week and invite them to get tested. If you receive this invite, it is a requirement to complete this test within the time range that you are given. But again, you may not get selected very often for that. It is a truly random sample of those accessing campus. For those who are unvaccinated, either partially vaccinated and in process of being vaccinated or receive a medical or religious exemption, you are required to take a weekly test. Again, we will be following up with that. Compliance is imperative, and failure to comply will lead to us having to share that failure with your school. And then finally, a very successful project we've done is the wastewater surveillance of our undergraduate residential buildings. This detects spikes of COVID-19. We will continue with that program, and if a wastewater spike is detected in a building, all residents of that building will be required to be tested within 1 business day of the spike. So it's a very all-encompassing, robust testing program, which has changed because of the vaccination requirement. So the vaccination requirement, you've all heard about it. You know that by August 2nd, everyone is expected to comply, and basically everyone, all students, faculty, and staff are required to have been vaccinated for COVID-19 for the fall semester. In the last few months in the United States, availability of vaccine and actually the eligibility for vaccine has shifted quite dramatically. We now have supply that totally outpaces demand. Everyone over the age of 12 in the United States is eligible to receive a vaccine. So if you are in the United States, you are expected to have received your vaccine and to do so by the deadline. If you haven't started that series, you need to do so now because time is running out in order to meet that deadline. For international students, we strongly recommend that wherever you are located, if vaccine is available, you take that vaccine and you receive the full dose as soon as possible so you have optimal protection where you are. As Donna mentioned, vaccines approved by the World Health Organization, as well as those authorized for use in the United States by the FDA, will be accepted with the appropriate documentation. But even if you have received a non-approved vaccine, it is worth receiving that, as you'll get protection in your home country, and then we'll manage your revaccination when you come to the United States. We ask you all to please submit your documentation through the secure student health portal as soon as possible. While the deadline is August 2nd, the sooner you do this, the better. And please follow the instructions, not just entering the dates when you received your vaccine doses, but also submitting the documentation, which I'll mention in just a moment. And please only submit once. I just need to say it's taking our offices about 15 business days to process these records because we're getting thousands and thousands of records. So don't worry. Doesn't mean we've forgotten you. If you submitted the backup documentation, it means we'll get to your records. If you only submitted dates, please go ahead and make sure you submit the documentation as well. I ask that you only submit once. Submitting multiple times just adds waiting time to the processing system. And you can check the status in your health portal, the same portal where you upload the documentation. Once your records have been reviewed, if they are acceptable, we will update the status in your health portal, and you will also see that checkbox appear in the Reopen CU app checklist. So in terms of what documentation is acceptable, we'll really accept anything that has the dates of the vaccine, the type of vaccine given, the location, and your name and date of birth. So that could be the CDC vaccine card, the World Health Organization booklet, or any letter from a physician or a clinic verifying you've been vaccinated with your information and the dates it's received. If this documentation is in another language, please also provide a certified translation so that we can read that and mark you as compliant. So regarding exemptions, we do understand for some students, they may wish to seek an exemption for medical or religious reasons. If this applies to you, we ask that you submit your request as soon as possible, and again, no later than August 2nd. The documents are submitted the same way you submit the vaccine information through the Secure Health portal, and then they are reviewed with an expert committee. A request does not guarantee approval. We'll notify you of the committee determination via your university email. And again, the exemption request process is only for medical or religious requests. We will not review philosophical or personal exemption requests. So in summary, I know those are a lot of things that you have to take care of. So hopefully this slide is just a summary reminder of the critical pieces you need to do and the date. So again, August 2nd is complying with the vaccination requirement, either uploading your documentation about vaccine or submitting your application for a medical or religious exemption. The compact, everyone has to re-sign the compact. Even if you signed it this year or you've never signed it before and you don't know what we're talking about, this is our kind of shared mutual approach to COVID. It is on that checklist. If you downloaded the app or you access it via the web, it's something you can all do right now. You read it and you acknowledge it, and then you'll see that checkbox. Everyone, again, who has not been on campus has to do the new training. The new training is going to be available, I believe, later this week. And make sure you do that by September 1. And then again, the testing requirement is that gateway test. As I explained, that needs to be completed by September 9th. I saw some of these questions come up as well in the Q&A, so hopefully just to kind of show you how we're phasing in or phasing out some of the safety requirements, which is really dependent on this vaccine mandate. So right now we're in this status where we don't know everyone's status around vaccination. So we still, even if you are individually fully vaccinated, you're still required to wear a mask indoors and distance indoors and test if you are selected. The masking and distancing is required indoors and outdoors for those who are not fully vaccinated. After the August 2nd deadline, indoor masking will still be required by those who are fully vaccinated, but the distancing requirement will change. And then our hope, beginning September 9th, when we are a fully vaccinated campus and the only folks on campus who are unvaccinated are those with approved exemptions or those arriving internationally who are partially through their vaccine, we will have the two different requirements. The fully vaccinated will only be masking indoors at CUIMC and in patient care areas, and will be participating in surveillance testing. Those obviously who have an approved exemption or are going through their vaccine process will still be required to mask indoors and outdoors, will be having weekly surveillance testing, as I explained, and will have to quarantine if they are a close contact of someone with COVID-19. Finally, I just want to remind you of the extensive resources we have for our students on both campus. Most of our services are available both in person and virtually, including our medical and counseling services. So please reach out if you need support before your arrival, but know that all our services are ready to welcome you back to campus and to support you as you come back to your academic and your co-curricular activities. We cannot wait to welcome you back. So I look forward to seeing you. I hope that's given you some understanding of all the different aspects of returning to campus. And I will turn it back. I think
Melanie, I gotcha.
You got me. Thank you, Joseph.
So thank you so much to both of you. Before we go on to Julie, I just want to pause and just the amount of work and thoughtfulness and care that has gone into these plans and the continual implementation of them has been extraordinary. So thank you both for your expertise and for all the work. And next, we are lucky to have Julie Kornfeld, and she's going to talk about academic implications and things to look forward to as we approach the fall.
Hi, everybody. I'm going to talk briefly because I know there are many, many questions, and I know you have also received many announcements from the university about our return to campus. And I want to reiterate, as Joseph has, how excited we are to welcome everybody back to campus and how hard we've been working to ensure ensure that you return to a safe and healthy campus. As you've heard from Melanie, there are many activities that we're doing on our part and many required of you as you get ready. So let me just say a couple things. And I think, again, you've heard this and you've heard it, I think, you've heard it from President Bollinger, you've heard it from Provost Kaus-Nelson and now Provost Boyce, as well as I know you're in communication and hearing from your deans, both at your schools as well as your deans of student affairs. But we are requiring all students to return to campus, and we are looking forward to welcome you back for in-person instruction and for activities. As Melanie showed you in our dates of vaccination and return to campus, when classes begin on September 9th, we will be a fully vaccinated campus. We will not be required to wear masks in the classroom, and distancing will not be required. For those, the masks requirement, as she said, is for those who are vaccinated. We will resume academic gatherings as well as social and extracurricular activities, and you'll be hearing from that from your schools. But we will be not having large conferences on campus and large gatherings on campus, and those will continue in many cases to be virtual. So just to keep that in mind, that as much as possible, we're hoping that campus will look much like you remember it if you've been here before, and much like we're excited to welcome you back. For those of you who are international, we do recognize that some of you will experience some delays in returning, particularly as it relates to visa appointments, and that you may not be able to arrive for the first day of the semester. It's possible that you'll be able to participate remotely in some classes until you're able to arrive, but you really need to work with the International ISSO, our International Student and Scholars Office, as well as your particular program, so that they're aware of your status, your times of arrival, and they can help you to continue to progress academically and participate in your program until such time that you're able to get here. So it's important to know that we will not be offering every course in a remote format. So please do work with your school and your advisor to ensure you have a plan in place for your specific program, so that, again, some programs, particularly those that have large populations of international students, will work with you to be able to enroll remotely in some cases so that you can continue with your classes while you return and get your vaccinations and return to campus. But you will need permission from your school or your program to do that. So please be in touch directly with your school and program on that. So that's pretty much what I have to say about academic planning. I think we are excited to welcome people back to campus. I know there are many questions, and I think we want to turn to some of those questions, particularly those that I think we've addressed many throughout these presentations. But Joseph, I'm going to turn it back to you and allow you to moderate us through the questions.
Great. Thank you so much, Julie, and for all of your planning and getting us ready for the full academic rigor of the institution as much as possible, given the pandemic. So we do have a number of questions. I'd like to start with a question that I think is best suited for you, Wafaa, and that is, there's lots of questions regarding variants and vaccine efficacy, and can you talk a little bit about that and help students understand the university's approach?
Sure, and thank you very much, and a pleasure to be with all of you today. So as you're well aware, variants of this virus are really new strains of the virus that arise as it multiplies and it's spread from one person to the next. And there are three things we worry about with new variants. First of all, will this new variant be more transmissible? Meaning it's easier, more contagious from one person to another. Number two, is this new variant likely to cause more severe illness? And then number three, has the variant the ability to overcome or outsmart our vaccines and our treatments and so on? So those are the three things we look at whenever we identify a new variant, and studies are done then to determine whether we're seeing one of these three effects. So all of you are aware that since the beginning of this pandemic, we've had different variants predominate over time. And the most recent one of concern is what's called the Delta variant. It's the one that was originally first identified in India, was then called 617, but now called the Delta variant. What we know for sure is that this variant is clearly more transmissible, meaning it's easier transmitted from one person to the next. And that's the reason why this variant becomes the dominant variant over time. So we know that now more than 80 countries around the world or so are reporting the Delta variant. And in some places, that variant is becoming the dominant, the most likely to be identified variant amongst all the viruses that are sequenced from a particular country. Now, the good news is that while this variant is more transmissible, we have the data thus far do not indicate that this variant is causing more severe illness. So that's really important. And we also have several studies now that do show that with several of the vaccines that have been examined and looked at, they appear to be protective against this variant. Now, these studies have not been done with all the vaccines that are available, but there have been studies that have looked at this with the Pfizer vaccine, the Moderna vaccine, and also I saw a study just today, actually, with the AstraZeneca vaccine as well. So what we are noting is that while these variants are arising, some of the vaccines have continued to maintain protective effect among those who are vaccinated against these new variants. So I think just that's to sum it up. I think, of course, we watch this very carefully, and particularly in populations that are not vaccinated, to see what's going to be the impact on these new variants on those populations.
Thank you so much. Melanie, you were getting a number of questions regarding vaccinations in particular. I know you covered this broadly, but particularly if people are getting their second dose after the August 2nd deadline, is that a problem in uploading? Wondering, if they aren't able to get it ahead of time again, and coming to campus, will they be able to go to class and engage and things of that nature? Can you just talk a little bit about that?
Sure. So again, the upload will still be open after August 2nd for those who are in flux. So continue to upload the day you get your second dose, and we will work to process those. However, depending on when you're arriving on campus, if you are uploading second dose late, this may impact your ability to access campus. And that's why there's this urgency to get it uploaded or get it done soon. We understand for some of our international students, there's no choice. You can't get the vaccine in your country. And we have reached out and are reaching out to you all to understand if that applies to you, to help us understand. So if you've received an email around this through ISSO, please complete the survey. This is only for international students, so we can help make arrangements for your vaccination. So don't worry. So the records will continue to be processed even after August 2nd. Again, the August records shouldn't be a problem at all. But if you're expecting to attend class on September 10th and you're only uploading on September 9th, obviously there is going to be more of a delay there. So again, our expectation is upload as soon as you get your dose. If you've got extenuating circumstances, we'll look at those.
Great. I'm going to keep you, Melanie, for a little time, if you will. So we're getting some questions regarding, well, if I have a red pass because I couldn't get my gateway test, how do I get access to get my gateway test?
You are not stuck in a never-ending circle. So that you get red passes for a lot of reasons. The folks at Lerner or the Black Building where you can go for gateway tests are very, very used to this. So long as your red pass is because you haven't done your gateway test or you haven't completed the vaccine requirements, they'll let you in. The only reason they won't let you in with a red pass is if you are actively having symptoms, in which case you shouldn't be there, you should be isolating. So don't worry, if you have no symptoms, but you still have a red pass, you can come into Lerner, our folks will let you in and you can get your gateway test done.
Great. The other question that's coming up a bit for several people, I think you've seen, is kind of the sequencing. So, I get the shot before you come, get here, quarantine. When can I get my gateway test?
Yeah.
When I get here. And the other question attached to that is if they're in a double, and with someone, the perspective was the person is vaccinated. If they're in a double with an unvaccinated person, do they have to quarantine?
Okay, let me try and hit all of those. So Vaccine as soon as possible, absolutely, hopefully before you get here in most cases. Gateway test as soon as you arrive, except, and here's the exception, right? If you have to quarantine because you're an international arrival who is unvaccinated, you're quarantining, you're not going to do that gateway test on day 1. You're going to go into your quarantine, and on day 3 to 5, there's some flexibility there. We're only open Monday to Friday, so you'll figure it out. Do that test because that's a double count. That counts as your gateway test, you're in quarantine, and as your travel test. And then you'll hit that testing requirement. So that's the testing piece. In terms of if you do have to quarantine for this travel quarantine, if you have a single bedroom, you can quarantine in your housing. So it could be your dorm room on a corridor or in an apartment style or a suite style. It's okay if you have a single bedroom. We know some of our students are in doubles, particularly with the undergraduate portfolio, and housing will be reaching out to our international students in that situation to figure it out. We will not make you quarantine in doubles. We will not make a vaccinated person have to quarantine because their roommate's coming. We'll make sure for the quarantine period that you are in singles so you can quarantine safely. And if there is this mismatch, one vaccinated, one unvaccinated, there won't be any concern. So please be checking your emails, particularly for our international students, around these surveys, these questions, so that we can help expedite all these things when you arrive to campus.
And then can you talk a little bit about the requirement for foreign vaccination documentations and translations? And also the second question, and then I'll give you a break, is what happens if one of the medical or religious exemption does not go through?
Sure. So as we've said, the approved vaccines are the 3 US FDA approved. Some of these are available elsewhere in the world as well: Pfizer, Moderna, and the Johnson & Johnson vaccine. Right now as well, there are 4 that are approved by the World Health Organization: Sinopharm, Sinovac, AstraZeneca, Oxford, and Covishield, which is basically AstraZeneca, Oxford. The World Health Organization is continuously reviewing. So many of you have received other vaccines, Sputnik, one other, that are under review right now. So if you have received those, upload the documentation. You upload it under the other unspecified COVID. It's worth uploading because if those are approved before our deadline, then you're in good shape and you won't need to get revaccinated. If they're not approved, we'll obviously guide you towards revaccination. And the last part of the question, I forgot.
I may have forgotten too, to be honest. Let's give you a break, Melanie. There's some questions, or at least one, about, there's been a word about boosters, and Pfizer and a booster, and, would the university provide a booster if needed, and kind of, what would the university's approach be, given the news that's out there currently?
I can take on the booster question, and there's been a lot of interest in this whole area of boosters. And just to let you know, there are 2 reasons for getting a booster. Number 1 is for waning immunity, meaning that over time the antibodies are going down, and therefore you need another shot to bring the protective antibodies up again. So that's one kind of booster. And there's another kind of booster where you do have protection, but there's a new variant, for example, where the current protection doesn't cover that variant. So this may require getting a booster by a new booster that would then protect against a new variant. The data we have thus far indicate that the protection we have now from these vaccines that have been examined is quite long-standing. Studies thus far show that antibody levels remain pretty good up to a year after vaccination, and there are ongoing studies to see how long it would last beyond that. So it doesn't look like we need to get another booster to bring our immunity up, because the immune system appears to be working fine and maintaining protective antibodies. And then the other issue is that it appears that some of these vaccines are protected against the new variants. So at this moment in time, there's really no compelling reason to say we need a booster now for either of these reasons. It doesn't mean that in the next month or 2 months, there may be new evidence that indicates that we need to get a booster, even though we've been fully vaccinated before. And obviously, if there's such a need, the university would provide such booster doses.
Thank you so much, Wafaa. Melanie, can you chat a little bit about expectations in the fall around flu vaccine and other immunizations and that students need to have that are required for the fall?
Sure. So the requirements for registration of the MMR vaccine for new students, so make sure you're uploading that. That is required for registration. And your meningococcal decision. Someone asked in the chat if meningococcal vaccine is required. It is not required, but you have to make a decision and document that. So either getting the vaccine or declining the vaccine or sharing your intent to get the vaccine. So those are the two requirements for registration. So you need to do those in order to register for classes. We've spoken about the COVID vaccine, and then for flu vaccine, this will again be required for students, but because flu season doesn't start till later, it is not required right now. Flu vaccines are not available right now. They become available usually at the end of the summer and into September, and we provide those at no cost to everyone on campus. So actually, we'll be offering flu vaccines on both our campuses at large-scale vaccine sites, and you'll be able to meet that requirement by getting vaccinated on campus or providing documentation. The deadline for that is usually much later in the fall semester. It is required for spring registration, but we'll be sending out a lot of messaging about flu vaccine. And then, Joseph, I remembered the last part of your question. It was about what happens if someone submits a medical or religious exemption request and it gets denied. So again, obviously everything takes time, right? It takes time for us to review the requests and send them to the committee. And then obviously if the decision is a denial, we will recommend that we will require that you get your vaccine, but we'll give you ample time to do that. So you won't be denied access to campus so long as you are going through the vaccination process. It will be the similar what I call temporary access process that we'll be giving for our international students who are partially vaccinated. So we'll be communicating with you about the timeline to do these things.
Joseph, we're all three of us, four of us are answering questions in the chat box. There's close to 200, and I'm noticing a few that we haven't touched on, which relate to when, and I think Melanie said it, but we want to reiterate it. If you have not gotten your second dose by August 2nd, don't worry. If it's August 4th, upload it on August 4th. If it's August 9th, upload it on August 9th. And if you were vaccinated months and months ago, some of you may have been vaccinated by the fact that you were in an eligible age group, you had an underlying medical condition. Your vaccine, if you finished your second dose in January of 2021, that's what you upload. You do not have to get revaccinated or go through any other process. So just to be clear about this, upload what you have, and as we go into August, we will certainly provide some understanding for people that, particularly coming from another country, who are in process during the month of August.
Great, thank you, Donna. Julie, can you talk a little bit, there's some questions about what's currently open on campus until September 9th. And then there's also some questions about when students would know what classes are virtual and be able to sign up for virtual classes if they're not able to be here.
Yeah, so I've tried to answer a few of those, but let me address that piece first. So I think everybody has seen announcements, and it is the expectation that all students will return to campus for in-person instruction and activities, unless you're enrolled in an online program, which is pre-established as an online program, and then you are actually a virtual student. For those students, as I said earlier, if you're delayed, and meaning you cannot get here because of a visa delay, and you're an international student, you're having problems with consulate appointments or your visa delays, and you're working with ISSO, you should be in contact with your program, and those programs will work with you. But it is not required, and not all courses are planned to be offered remotely. We have returned to in-person instruction. This is not the case as it was last fall, when we knew that that students couldn't return to campus because of public health reasons. So if you are unable to or uncomfortable returning to campus, and you don't have an accommodation because of a disability, you need to speak to your program about a possible deferral or leave of absence until you feel that you can return to campus. Because we are not all programs will not be offering remote classes for remote participation. Again, for those students who are delayed due to circumstances beyond their control, in terms of mostly international students, in terms of visas or delays. If you have an underlying health condition and you want to work with the Office of Disability for a medical accommodation, you should do that just as you would have done so prior to the pandemic. So hopefully that answers that question. It is our intention, and facilities are opening, the libraries will be returning, and facilities are opening, the gyms, et cetera. And it is the intention that these facilities will be open when we return to campus, again, subject to if there's any change in public health conditions. I don't know, Donna, if you want to comment a little bit more about facilities or other kinds of things being open on campus.
Sure. We've created something on the COVID-19 website. It's called, there's several sections that are important. One is visitor guidelines. We had a few questions in the chat about, visitors, and we've tried to categorize visitors, and some visitors will be required to be vaccinated if, for example, their visit is long-term. So it might be a visiting scholar who comes in for a month or two. They would be required to meet the vaccine mandate. Other very short-term visitors, think about like a delivery person. There are no requirements for the delivery person who is dropping off a box or dropping off a meal. But there are some requirements for a visitor who might be coming in to provide some construction, repairs, et cetera. So we have different categories because we want to assure, and I can tell by the tone of the questions, that people are very concerned about people who might be unvaccinated. The second thing that Julie was mentioning was what we call events or gatherings. And there are many different types of those things. Some of them are purely academic, and as you heard at the beginning, academic gatherings, whether it's a class, whether it's a test, whether it's some kind of a seminar for Columbia affiliates, it's graduation, it's other kinds of gatherings. Those have no limits to them because everybody on campus who is an affiliate will be vaccinated. Whenever we have a outside person in, they either must fill out a attestation that they have no symptoms, or they must they must comply with the vaccine requirements. Now, convocation is coming up, and that will be both move-in and convocation, at the end of August are coming up. And we are going to ask non-Columbia affiliates, so parents, for example, to wear face coverings because we have no way of checking their vaccine status. And we just think, given the substantial numbers, that we're going to, have a potential problem with people who may not be vaccinated. So there are guidelines on the website around types of individual visitors as well as the types of gatherings that are permitted. And I think it's important to, and again, the tone of some of the questions and concerns about the Delta variant is, this is where we are today. We might change. We may change because we see greater positivity or we see more cases being hospitalized. And so we will recalibrate as we see some of those things and hopefully not have to deal with going remote again, but simply, adherence to more additional safety measures, perhaps like distancing or more face covering than we anticipated.
Great. Thank you so much, Donna. Melanie, there's some additional questions on the gateway testing. If you can reiterate, how do they book an appointment? How long does it take to get the results on average? And if you're one of the individuals that has to take a test 3 to 5 days after arrival, does the gateway test apply toward that?
Yeah. So you book these through the secure.health.columbia.edu portal, the same health portal many of you are using to upload your records. We only open that schedule 7 to 10 days in advance. So if you're looking right now for end of August appointments, you're not going to see any. And don't worry, it doesn't mean they're all booked. We're just not opening the schedule. We find that people, if we open it too far in advance, people schedule and they don't show up, and then we have a lot of no-shows. So we will have adequate capacity to manage everyone, but the schedule's only open about 7 to 10 days in advance. So just set a reminder on your phone to schedule that before your return. That's how you book those. We don't do walk-ins. As I say, the two main sites are the Lerner Hall site and the Black Building at CUIMC. There are other sites. I've seen some questions around these. Tarrytown, West 51st. These are mainly for people working there. If you manage to get an appointment there, it's fine, it counts. But basically, the only tests that count toward this requirement are ones that are scheduled through our portal at one of our sites. You're right, Joseph, if you are an international unvaccinated student who is required to quarantine, you're required as part of that quarantine, and this is from the CDC recommendations, to get a test 3 to 5 days after your arrival in the United States. Because you'll be quarantining here, you can leave your quarantine to come to our testing site. So long as you don't have symptoms, you can get that test. And as I say, it's a 2-for-1. It counts as your travel test as well as your gateway test all in one. So you know, no need to do it twice during that week. We'll only let you in once and send you away the second time.
Great. Thank you so much. I got a question I can answer, I think, a couple of these questions. There's a question regarding the checklist and not being able to find the compact on the app. And so if you look down below the attestation, you'll see your checklist there. And then there will be a check saying I've signed the compact, and you can click right next to it. If you haven't signed the compact yet, you should be able to click right next to it, and you'll be able to read the compact and approve it right there on your app. So it's a pretty immediate thing for you to do. And if you have trouble with it, you can email us at universitylife@columbia.edu and we can help you with that. The other question I got is, why is the gym open up only for undergraduate students? And that's actually not correct. So the gym will be available for undergraduate and graduate students. And my understanding is it has been supporting graduate students during several months now, during spring and summer. And so so that's good news. So get ready for your well-being and being able to access to the gym with all things continuing as they are right now. There's a number of questions regarding student health insurance, and about, I think some were about, do I need insurance in order to, the student health insurance to get the vaccine? Some are about when to apply and when does the coverage start. Can you just give a broad overview, Melanie, about insurance?
So all full-time students are required to have health insurance. It is a requirement for Columbia. International students are required to have the Columbia student health insurance plan with a few exceptions. Everyone is automatically enrolled in the Columbia University Aetna student health insurance plan. If you have comparable insurance, you can waive off of that. The open enrollment period opened today, which is probably why these questions are coming up. And you have until September 30th to waive off if you do have alternate insurance. So make sure you go ahead and review all of those. But having health insurance is a requirement for full-time students. However, your health insurance is not linked to either the testing program on campus. That is something that the university just supports regardless of your health insurance. And similarly, for vaccination, it doesn't matter what insurance plan you have. There is no charge to you either at Columbia or any of the New York City sites to get a vaccine. And it doesn't matter what your insurance status is in order to do that.
And just while I have it, I know the answer, but I'll let you answer it. So a student asked, they're a little confused. So with the vaccine card, do they submit it to their health portal or do they submit it to the app?
Good question. So let's make sure we clarify. For students, we ask you submit it through the health portal. Our employees are submitting through the app, but students do so through the health portal. It's where everything lives. It's living in your secure health portal. You can review it. So again, just to reiterate, you submit through your health portal for Morningside students and your CUIMC health portal for CUIMC students, and you add the dates as well as the documentation. I've seen questions where students are saying, I added my dates months ago and I'm still not cleared. If you only add the dates, the records will not be processed. We need a PDF, a photo of the actual vaccine documentation so we can verify those dates. So if you haven't got clearance and it's been more than 15 business days, please go back into your Secure Health portal, make sure the documentation's there. If not, please add it.
Thank you. And then Donna, maybe you can help with, there's a number of questions, people have heard about the Excelsior app. There's questions whether or not they should get it. Is university creating such an app? Can you talk a little bit about that in relation to Reopen CU?
Sure. So New York State has created something called the Excelsior app. I actually have it on my phone and can show it to you. It is not recognized by Columbia. Not that it's not valid, but there is a restriction around using the data here for a third party. Now, there are many public venues that you may find this helpful to have. Some of the sporting events, for example, will say, show us your app. It's much easier than worrying about that little CDC card, which can go through the wash and can get torn and otherwise destroyed. So we would encourage you to download the Excelsior app. What's nice about it is you only have to put in your name, your date of birth. There may be one other element, and because whenever anyone gets vaccinated in New York State, that information goes to the New York State Registry. So the New York State Registry recognizes my name, my date of birth, and whatever other element I put in when I did this, and it matches with the records that the vaccination station provided to New York State. So unlike, for example, in our Reopen CU app, you've got to manually enter when you got it, what you got it. Actually, I think I know what the other element on the Excelsior app is. It's the last date, the date of your last dose is the only thing that you have to remember, and then they match it. So I have found this handy. I had to use this to go to a concert, but on the Columbia campus, this is not recognized as the way that we prefer that you show your vaccine status. It will simply be the Reopen CU app.
Perfect. And we're getting close to time. What I noticed in a lot of the questions, there are repeats. Someone's asking, what is the app? Some people are asking more about visitors. Donna, if I'm a student and maybe I came in late here, and where can I go online to get all of this information and go a little more in detail there?
Great. So I would encourage you to go to the COVID-19 website, which is covid19.columbia.edu, and you can find whether it's some of the specific questions that Melanie was talking about, or travel or group sizes and things like that. There on the far right-hand corner of the app is something called FAQs and a search glass, and all you do is type in and you will find thousands of frequently asked questions to be able to give you information. And this is being recorded, Joseph?
Correct, and this will be on the University Life website.
And I think it will also be on the COVID-19 website as well.
It's perfect. I have a couple of these will be the last two, everyone. I'm so sorry, but you can also continue to send emails to universitylife@columbia.edu if you like, if once you've gone to the website and still can't find your information. There's some unique situations where someone's an employee and a student. So, if we oftentimes have that dual, where should they upload their information if that is a situation for the vaccine?
Melanie, you want to take it?
Sorry, I missed the question. I was too busy typing on.
Oh, it's fine. I know you're working away. So we've gotten 147 answered on there. How many, if someone's an employee and a student, where should they upload their vaccine?
Yeah, we will share the information. So we ask that you upload it through the student portal is easier, but we will exchange the information if it winds up in the wrong place. Okay,
great. And then can you just reiterate, there are a number of things again about testing, what the testing requirement will be for vaccinated and unvaccinated, just to reiterate that it's closed.
Yeah. So gateway testing for everyone, regardless of vaccination status, if you haven't had a gateway test done in 2021. So everyone gets that first test. Then if you are fully vaccinated, you will be entered into the random sample every week. We take that from the swipe data on our campuses, and we select a random sample for testing every week. You may get selected multiple times. You may get selected very infrequently. If you are unvaccinated, which means you have a medical or religious exemption, or you're in the process of being vaccinated, as may apply to our international students, you will be required to get tested weekly. And that's a testing program. And again, then the wastewater program, if we detect SARS-CoV-2 in wastewater, residents of that building will be required to test.
Perfect. Thank you so much. I just, want to pause and thank each of our panelists for sharing their time, their expertise. I have to tell you, we're so incredibly fortunate to benefit from the rigor and discipline and the expertise of all of you, and all the work that you've done and all the work that your teams have done in order to get us to this moment in time and to move us forward as an institution. So please accept our gratitude. Your collective leadership and the effort that you are putting into place has made it possible for us to return back safely this fall and reopening the university campuses. Today's conversation provides helpful information and context setting for each of us to understand what to expect in the fall and to help to plan better for the fall. And again, please check the university's COVID-19 website. Much, if not all, this information is there. If you continue to have questions, at University Life, we will continue to communicate out, as well as others in this space, and making sure that you're getting information, cutting edge information to help you in your planning. And you will be invited again to another forum in August that if you didn't get your questions answered today or continue to have questions, and as things continue to progress, we will have university updates for you in August as well. I want to thank all of our audience members for taking the time to come together today and to learn and to ask these questions and hard questions and to listen. And here at University Life, we remain committed to these important conversations and ensuring that as members of the community, you have access to the best and most actionable information possible. As a reminder, we love to hear from you at University Life, either on this topic or anything else, any ideas that you may have. So you can always reach out to us by email at universitylife@columbia.edu. You can also follow us on Instagram and Facebook. And you can always go to our website to learn about future events such as this and others that you can get engaged with and be active in. So with all of that to be said, we're very excited to welcome you home to Columbia in the fall and to continue these dialogues in preparation. And thank you again for joining and all that you're doing for our campus community. We hope you have a wonderful evening.